Now, with the ratio of staff to patient growing smaller, there's an increased reliance on technology to improve patient experience and outcomes. STANLEY Healthcare manages their systems to keep healthcare workers away from the paperwork and focused on the sick and infirm. Jonathan Briggs went to the Dewsbury and District Hospital in Yorkshire to find out how.
If you've ever spent any time in a hospital as a visitor or a patient, you can't fail to have seen the amount of time that staff spend on administration. But STANLEY Healthcare have come up with a real-time location system that can keep track of NHS assets, allowing care staff more time to do their primary job.
If you can imagine you're working on a busy ward and you need a piece of medical equipment, in days gone by, we would have had to have a member of staff running round the hospital, ringing wards up, disturbing other members of staff. Now we're able to locate those pieces of medical equipment really very easily, quickly, and those pieces of equipment are used on patients so that those patients receive their care promptly.
A wheelchair is a very good example of one of the pieces of equipment that we regularly track and some real value that we can add to the product. Wheelchairs commonly get abandoned in car parks and they can now be seen and visible for the porters and the staff to be able to bring those back and make them available for patients.
The tags use the existing Wi-Fi infrastructure of the hospital and can be set up to contact the network at a user-defined frequency, usually around every 5 to 10 minutes. Dewsbury has around 3,500 already in operation.
The tags work in a variety of clinical locations. For example, they work in operating theatres when we locate ultrasound scanners. They work in patient areas for wheelchair location, specialised equipment like bariatric chairs and beds. So at the click of a button, we know where everything is. The data we collect, it also gives us some financial information of where the investment should be at the right place, rather than having equipment lying around.
So given that you can attach one of these to just about anything, we've decided to attach this one to me. It's all set up with my details on here. And you can see that's me, ready to go. So let's see where I end up in the hospital during the course of today's filming. But it's not just geographical location. The tags can also monitor changes in temperature for sensitive medicines and vaccines, for example.
We need to ensure that the temperatures are constant so that we can comply with the CQC regulations and at the same time provide really high level of patient safety.
Despite the Care Quality Commission's requirements, the majority of records for hospital fridges are manually monitored, which is time-consuming and error-prone.
You would probably see in most instances a scrappy piece of paper that's got various different signatures and dates on it. Sometimes these pieces of paper are lost and we're not always assured that they're filled in correctly. The new system will completely obviate that need.
The nurse is ultimately on the ward to be able to care for her patient. You don't get the chance to be able to go and write down manually a temperature in a fridge. And even if you do record it, do you have time to be able to acknowledge that temperature and then to react to any non-compliant temperatures?
So I've had this in my pocket for the last couple of hours, and here is where I have been. And you can see my movements very carefully documented on the screen. This is the second floor of the Dewsbury and District Hospital, mostly centred around one ward where we were doing most of the filming in the last couple of hours. But you can see that the future possibilities of this little tag are really quite intriguing.
There are situations that where we have vulnerable patients that are be able to be afforded more freedom by being able to locate where they are. So dementia patients being allowed to wander further without being kept in the confines of a ward area.
I think the technology could be used appropriately to support people who perhaps are lone workers. So if we have colleagues who are working by themselves out in the community to support their safety, we could help them.